Hello, this is Dr. Ahmed, and today we're talking about something that's rapidly rising in global concern, COVID-2025. If you thought COVID was behind us, think again. A new wave of concern is sweeping across countries as the term COVID-2025 trends globally. But what exactly is it? Are we entering another pandemic phase? In this video, I'll explain the truth behind COVID-2025, how it's different from the original outbreak, what symptoms to watch out for, how to protect yourself, and some shocking insights you haven't heard on the news. What is COVID-2025? COVID-2025 is not an entirely new virus, it's a mutated strain of the original SARS-CoV-2, the virus responsible for the COVID-19 pandemic. Think of it like a cousin, similar in structure, but with some new tricks. This version appears to have greater environmental survival, and in some areas, mild resistance to older vaccines. It's been detected in small clusters, particularly in urban areas of Europe, Southeast Asia, and the US, prompting localized lockdowns, mask advisories, and renewed public health briefings. The World Health Organization and CDC are monitoring its spread closely, though it hasn't been declared a global emergency yet. Common symptoms of COVID-2025. So how do you know if it's COVID-2025 and not just seasonal flu? Doctors are reporting slightly different symptom patterns than we saw in 2022. Early symptoms include: number 1, mild fever can fluctuate day to night. What it feels like. A low-grade fever 99.5 degrees Fahrenheit to 100.9 degrees Fahrenheit, 37.5 degrees Celsius to 38.3 degrees Celsius, where you may feel warm, flushed, or even have slight chills. Often it spikes in the evening and improves in the morning. Why it happens? The body is mounting an immune response against a virus. This temperature fluctuation is common in viral infections where the immune system works hardest overnight. Why it matters? Mild or fluctuating fevers are often overlooked, but they can signal the very beginning of a respiratory or viral illness. Number 2, fatigue and muscle aches. What it feels like. You may feel abnormally tired even after resting. Your limbs might feel heavy or weak, and you may experience dull aches in the back, shoulders, or legs. Why it happens? The immune system releases inflammatory chemicals like cytokines to fight the virus, but they also affect the body's energy and muscle function. Why it matters? This is often the first or only symptom in the early phase, especially in seniors or individuals with chronic conditions. Number 3, dry cough or throat tickle. What it feels like. A non-productive dry cough that feels like a scratchy itch deep in your throat or upper chest. No mucus comes out initially. It may worsen when talking or lying down. Why it happens? The virus irritates the lining of the throat or upper respiratory tract, triggering cough reflexes before deeper lung involvement begins. Why it matters? This can precede more serious lung symptoms, like shortness of breath or productive cough, especially if ignored. Number 4, what it feels like. A dull, persistent ache, often around the temples, forehead, or behind the eyes. Sometimes it can resemble tension-type headaches. Why it happens? Dehydration, inflammation, fever, and sinus pressure can all contribute to headaches during early infection. Why it matters? It's a non-specific but important signal, especially when it appears with fatigue or fever. Number 5, slight burning in the chest. What it feels like. A mild, uncomfortable burning sensation behind the breastbone, not sharp pain. Can increase with deep breaths or coughing. Why it happens? Due to irritation of the upper airway or early inflammation of the bronchial tubes, bronchitis-like reaction. Why it matters? It may signal the start of chest involvement, even before more serious symptoms like wheezing or shortness of breath develop. Number 6, nausea or upset stomach in some patients. What it feels like. Queasiness, a feeling of fullness, mild abdominal cramps or bloating, sometimes paired with loss of appetite. Why it happens? Certain viruses, including COVID and RSV, can affect the gastrointestinal system, especially in seniors and those with weaker immunity. Why it matters? GI symptoms may appear before or without respiratory symptoms, so they should not be dismissed. Number 7, new sinus-like congestion and ear pressure. What it feels like. Stuffy nose, mild facial pressure, postnasal drip, and a blocked or full feeling in the ears, similar to a sinus infection. Why it happens? Newer variants and respiratory viruses in 2025 have shown increased upper respiratory tract involvement, including sinus cavities and eustachian tubes. Why it matters? This symptom profile closely mimics a cold or allergy, leading many to ignore it, but it can be an early warning sign of contagious viral illness. Some patients also report brain fog, dizziness, or short episodes of confusion, particularly in older adults. Symptoms may show up 3 to 5 days after exposure and can last up to 14 days, with lingering fatigue for some. How to protect yourself. Prevention is your best defense. And here's what doctors like me recommend. Number 1. Wear a mask in crowded indoor spaces. Why it matters. Respiratory viruses like COVID, RSV, and influenza spread through droplets and tiny airborne particles, especially in enclosed, poorly ventilated areas. Where to be most cautious. Airports, high traffic from multiple countries. Buses, trains, limited airflow, close contact. Hospitals, clinics, high viral load due to sick patients. Pro tip: use N95 or KN95 masks for better filtration, especially if you're immunocompromised or over 60. Number 2. Keep your hands clean. Why it matters. You touch your face, phone, food, and eyes countless times daily. Viruses can survive for hours on surfaces like door handles, elevator buttons, and railings. What works best? Soap and water at least 20 seconds break down the virus's outer layer. Use hand sanitizer 60 to 70% alcohol when soap isn't available. Don't forget, wash hands after using public transport, handling money, or touching communal surfaces. Number 3. Ventilate your home. Why it matters. In poorly ventilated areas, airborne virus particles linger in the air, increasing your exposure with every breath. How to improve airflow. Open windows and doors when possible. Use exhaust fans in kitchens/bathrooms. Consider a HEPA air purifier, especially in bedrooms. Even 10 to 15 minutes of ventilation a few times a day significantly reduces indoor virus concentration. Number 4. Avoid touching your face when outside. Why it matters. Your mouth, nose, and eyes are direct entry points for viruses. Touching your face after handling doorknobs, phones, ATMs, shopping carts, can transfer viruses directly to your system. Discipline is key. Even subconsciously rubbing your eyes or biting your nails can expose you. Number 5. Boost your immune system. Why it matters. Your immune system is your natural defense. When it's strong, it kills viruses before they spread. Key habits that help. Eat fresh fruits, vegetables, nuts, and whole foods rich in vitamins. Sleep 7 to 9 hours. Sleep is essential for immune repair. Hydrate. Water helps flush toxins and keeps mucous membranes moist. Vitamin D. Many people, especially seniors, are deficient. Low vitamin D is linked to higher infection rates. Ask your doctor about supplementing vitamin D, especially in winter or if you stay indoors often. Number 6. Stay updated with boosters. Why it matters. Viruses mutate. Boosters are updated to help your immune system recognize and fight new variants. Who should definitely get them? Seniors 60 plus, diabetics, people with asthma, cancer, kidney disease, those on immune-suppressing medications. And if you feel unwell, isolate immediately and test within the first 24 hours. Hidden facts you should know. Let's now uncover what mainstream media might not emphasize enough. Mutation fatigue. Just like influenza, the virus keeps mutating every few years. It develops small changes in protein spikes. This makes older immunity less effective. That's why yearly vaccines might become the norm. Long COVID risks are real, even in mild cases. 1 in 5 people report lingering symptoms months after infection, especially memory problems, joint pain, and breathing difficulties. Environmental factors. Many scientists now believe climate change is accelerating virus mutation. As ecosystems are disrupted, viruses that once stayed dormant are finding new pathways to humans. Old vaccines offer partial protection. Data shows that 2021 to 2022 vaccines reduce severity, but may not stop infection entirely with this new strain. However, boosted immunity still saves lives. Seniors are at highest risk over 60. Even if vaccinated, your immune response may be slower. You must stay ahead, test early, treat early, and don't delay. COVID-2025 may not be a global crisis yet, but it's a global warning, a reminder that the pandemic isn't truly over, it's just evolving. Stay alert, protect your lungs, educate your family. Share this video with someone you care about. If you found this video helpful, please subscribe to Lifelong Vitality for more expert-backed health updates. And in the comments, let me know what's your biggest concern about COVID-2025. This is Dr. Ahmed signing off with one message: stay safe. Stay strong, stay informed.